Mediterranean diet health benefits. The Mediterranean diet, characterized by high consumption of fruits, vegetables, whole grains, olive oil, and fish, is associated with reduced risk of chronic diseases and improved cardiovascular health. Overview. The Mediterranean diet is a dietary pattern inspired by the traditional eating habits of people in Mediterranean countries. It emphasizes the consumption of plant-based foods, healthy fats, and moderate intake of protein, with a focus on whole grains, legumes, and olive oil. This diet has been extensively studied for its health benefits, particularly in relation to cardiovascular disease, diabetes, and cognitive function. Pathophysiology/mechanism of action. The beneficial effects of the Mediterranean diet are attributed to its anti-inflammatory properties, high antioxidant content, and favorable lipid profile. Olive oil, rich in monounsaturated fatty acids, MUFAs, helps reduce low-density lipoprotein, LDL, cholesterol while increasing high-density lipoprotein, HDL, cholesterol. The diet also includes fiber-rich foods that support gut health and regulate blood sugar levels. Additionally, the consumption of omega-3 fatty acids from fatty fish like salmon and mackerel contributes to reduced inflammation and improved endothelial function. Clinical features/indications. The Mediterranean diet is recommended for individuals at risk of cardiovascular disease, type 2 diabetes, and cognitive decline. It is also beneficial for weight management and improving metabolic health. The diet is often used as a lifestyle intervention to complement medical therapy in the management of chronic diseases. Diagnosis/monitoring. There is no specific diagnostic test for the Mediterranean diet itself. However, the dietary pattern can be assessed through food frequency questionnaires, FFQs, or 24-hour dietary recalls. Monitoring adherence to the diet involves tracking nutrient intake, particularly for fats, fiber, and protein. Laboratory values such as low-density lipoprotein, LDL, cholesterol, high-density lipoprotein, HDL, cholesterol, and fasting blood glucose levels can be used to evaluate the diet's impact on metabolic health. Treatment/management. The Mediterranean diet is typically managed as a dietary intervention rather than a pharmacological treatment. It involves gradual changes in eating habits, such as increasing vegetable and fruit intake, replacing saturated fats with unsaturated fats, and incorporating more whole grains and legumes. In some cases, the diet may be combined with lifestyle modifications like regular physical activity and stress management. For patients with chronic conditions, the diet can be tailored to meet individual nutritional needs while maintaining health benefits. Key clinical points. 1. The Mediterranean diet is associated with reduced risk of cardiovascular disease, type 2 diabetes, and cognitive decline. 2. It is supported by evidence for its role in improving lipid profiles and metabolic health. 3. Adherence to the diet can be monitored through dietary assessment tools and laboratory tests. 4. The diet is often used as a complementary approach to medical therapy in chronic disease management. 5. Individualized modifications may be necessary to optimize outcomes based on patient-specific factors. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.